Good morning, everybody. Here's another patient testimonial. I'm here with Laura. Laura came to see us around the beginning of February with severely debilitating knee pain. It was so bad that she was strongly considering getting surgery because she just couldn't do anything to take care of herself around the house. Then she saw one of our flyers in the mail, and, well, I'll let Laura finish the rest of the story here. All right, Laura, take it away.
Hi. I came to the clinic because I really was at the bottom of the bottom. I had struggled for a long time, months and months and months, with knee pain that just gradually got worse. And I was convinced at some point that I was going to have surgery. And at my age, I understood that as being somewhat of the norm. People get knee replacement surgery at my age. And I was convinced I was going to have that. One day I'm sitting and going through my mail, and I see a flyer for this particular clinic that advertised, "We can help you with knee pain." So I thought it was God sent that I at least make a phone call, and I did. I came in, I was evaluated extensively, and I started therapy immediately. And one of the first things that they did for me was used a laser, which I was totally unfamiliar with. But the MLS laser is painless. That is the easiest part of it all. But they work with you, explaining what needs to be done, why they're doing what they're doing, which is also very important because a lot of times doctors and what they do can be scary for patients that don't know. And so I started gradually with that, and then I went into the Trigenics with Dr. Gatsky. And I'm here to tell you that I'm a whole new person. I'm not 100%. I still have a lot of work to do, but when I first walked in this door, I was grabbing panes of the door to help stabilize myself. I had fallen at home twice. I was very, very concerned about breaking a hip because I just didn't have any stability. I didn't have any strength. The laser helped that, but as I continued with my therapy, Dr. Gatsky did a lot of different techniques, a lot of readjusting, a lot of adjusting. At 66 years old, I've had a lifetime full of injuries. I've had a lifetime full of surgeries that I now realize maybe I didn't need to have. But I'm grateful for all that was done. One of the things that I need everybody to know is that this is not a painless process. And I repetitively tell Dr. Gatsky, I don't like you today. And I don't. I don't like him. It hurts. But within a minute or two, I can do something that I couldn't before I got here. So it's like anything in life. Pain is part of life, but if there's no pain, there's no gain. So unless you do something about whatever is wrong, and give this particular process an opportunity to work, you're never going to know if it can. And I'm so grateful. I can do yard work, I can vacuum, I can dress myself. Those were all things I couldn't do before. So after 75 days, I feel like a new person. And again, I'm not there yet. I'm not where I want to be. I don't want to run a marathon again. I don't want to work out every single day, but I do want to garden. I want to be able to go grocery shopping. I want to be able to take care of my house and my pets, and I'm well on the way to doing that now.
Just to reiterate, because so the patients understand what the difference 75 days makes. How long have you been suffering with this problem, give or take?
First of all, the diagnosis is that I have curvature of the spine.
Mm-hmm.
So the thought process is that was sustained as a child, probably very young, and it went untreated. So I have to tell you that all my life I've had issues. But, you know, before this particular opportunity arose, I mean, you'd go to an orthopedic surgeon or you'd go to therapy and you put a Band-Aid on a situation. And what I like about this particular process is you guys work with me to figure out, where did this all stem from? There's a history here. Let's figure out what the problem is that caused you to have this issue or that issue. I've had both hands with carpal tunnel. I've had 2 rotator cuff surgeries. I was not opposed to having surgery. Orthopedic surgeons are wonderful. But if it's something I don't have to go through, and I can correct whatever has gone on throughout this life of mine, I would say, though, the last 2 years have been pretty rough as far as it goes with the knee. That was really the breaking point where I knew something was really off, was really wrong. So I would say the last 2.5 years maybe, and I kept making excuses. Oh, I bent the wrong way, or I shouldn't have lifted that, and maybe I shouldn't have, but it shouldn't have gotten that bad.
Exactly. So I just wanted to reiterate for the people who are watching this that it took, with there being a break, a month-long break in there, 75 days for a 2-year problem to resolve.
Or longer.
Or longer, yes. All right. So now, lastly, it seems like I already know the answer to this question, but if somebody's watching this is in your same position, would you recommend that they give our clinic a call?
Absolutely. I mean, first of all, what have you got to lose? It's not invasive, so to speak. It's not somebody that's sticking a needle in you. I mean, I've had cortisone injections and they work, but they don't work forever because you're not addressing what is ultimately causing these flare-ups or causing, and pain upon pain, your body somehow adapts to it. And I don't know how that works, but unless you get to the root of the issue, you're never going to get better. You're going to have more surgery. You're going to have more pain. You're going to have more instability. You're going to have more things you're going to figure out as you age you can't do. And I just refuse to accept that.
Good. So thank you very much, Laura.